I think that is a whole mess of things right there that we're missing. Because what we've been told is if you're sick during COVID, we're going to cancel your elective surgeries. What we've been told is if you're sick during COVID, the hospitals aren't going to be able to help you. You might as well just figure it out at home, even if you have a heart attack. That's basically what the message has been. And if you think I'm lying, just look it up. There were some policy changes within these EMS and other places saying if you can't resuscitate, you have to leave the scene. I mean, this is how bad it got in New York. But also, it's how bad the media panic got. And I talk about this from an experience because yesterday I had, I guess, part 1 because I'm going to have part 2 tomorrow. I'm an endoscopy in the Bronx, sitting there in what I'm sure was a room filled of COVID patients in the Allen Pavilion just a few months before. And, I just thought to myself, electives were not able to be done. That was a leadership call. So I wonder if there's a way we could find electives to be done. I wonder if we can finally have an honest conversation that says, you know why we have to protect ourselves from COVID? Because our underlying conditions that some may have lead to it affecting us even more. I wish that conversation was had. Instead, literally splashed, and it's horrible that even a 30-year-old now has caught COVID and died. That is just ridiculous. It's horrible. And it does talk about social responsibility, right? If your health matters, you need to take social responsibility for those around you, for yourself. We'll get that in a minute. But as I'm sitting there, waiting my endoscopy, I'm just thinking a lot. Thinking that, these procedures were not allowed. Thinking that majority of the news cycle the last few months during COVID was simply the word COVID. Yeah, I say the word because the condition, it was talked about, but did they ever acknowledge the underlying causes of the condition? Of why someone who got COVID was going to be heavily impacted? I don't think so. And I think it's important to recognize all health matters. And I hope that you take your health seriously. I hope you do. I try to. I'd like to think I do even more, but it gets frustrating. It really does. When you have a system that is so unique, even to yourself sometimes, it gets frustrating. But we push through. We push through on this podcast. We push through on this vlog. We push through any which way possible. But I'm here to tell you today on this edition of Alex Garrett Podcasting, all health matters. And it's up to us, too, to make it matter, right? So if you were hearing the news and you were afraid to even talk about what you were going through because you had the panic, it's time to get over that. We should have gotten over that. We should have been told not to panic even if you have something else that was going on with you. I won't say wrong because I hate that says, oh, what's wrong with you? Nothing's wrong. You're just going through something right now. Nothing's wrong. Your body's just reacting differently to something and you need to get it taken care of. There's nothing wrong with anybody, as a matter of fact. And for those who did have something wrong, they were told they would be in the wrong for going to try and figure it out. They would be in harm's way. Not only that, they were also told, oh, well, we don't have enough bed space. So if you try and come here, we can't take you because we have to take that COVID patient over there. Okay, but what about the healthcare of someone else during COVID? I admire what our first responders did those few months and continue to do. I really do. I just wish there was governorship that would say, you know what, we're not going to cancel elective surgeries. you need something done, you can get it done. I wish there was a leader that would say, you have to go to the hospital still, you have to get to that hospital no matter what. I didn't see that. I really said, I really heard, maybe I heard wrong, stay home if you have something else wrong with you. We're only dealing with COVID right now. And this was reverberating throughout the media circles everywhere. So is it offensive to say all health matters? All health conditions matter? I don't think so. Is it time someone finally said that to an audience? I think so. I mean, I heard it on other circles, but not in the mainstream. All we got were articles of people having to be left because they couldn't be resuscitated and they had to go to another patient. All we were told were electives are canceled. Telehealth, that's the way to do it. What happens if we had a literal issue to take care of? Where would we go? So I hope if this wave does come back to New York, I hope with these waves in general, that at least there's someone speaking up and saying, hey, we're going through this right now. We have a spike right now, but we need to make you understand that your health does matter too. Your conditions matter. Your whatever you got going on with you matters. And we're going to prioritize that just as much as that sickly COVID patient over there. And if I'm going to say all health matters, then I also should say social responsibility with this matters. I am sometimes, the last few times I was in the city, frustrated that these people, yes, it's great outdoor dining is going on, but I was frustrated that they were so close together and really not always wearing a mask. That frustrates me. What you could do is you could put the mask on, have it underneath your chin, or have it on during talking, then when you're eating, put it back on. I saw a very interesting thing. There was a soccer game on last night. And this coach didn't wear a mask, but he covered his mouth to complain to the ref. This was coaching in 2020, right? He puts his his hand over his mouth to talk to the ref to actually complain about a decision, to protect himself and to protect the ref, who was masked. So let's be smart. Let's enjoy the benefits of having reopening, but let's also say, what can we do? Let's also not pinpoint bars. You know, how cruddy do bar owners feel right now? Because they're being targeted. Well, see that bar over there? Well, maybe it wasn't the bar. Maybe it was the people in the bar. Maybe it was people who went to the bar. I'm not going to judge where they came from the last couple months. But maybe it was people who came to the bar to have a drink after whatever and didn't take care of themselves. Why bar? See, they'd say social responsibility, right? They want social responsibility. Yet, what do they first talk about? The bar. Maybe it's not the bar owner's fault. Maybe it's the people that went to the bar's fault that they got sick. Maybe that's who you should be talking to. Fauci, I don't want to blame anybody, but you got to do better. And he basically was calling out the bar too. I mean, it seems in this time, one health crisis, one health issue matters to people. And we're told nothing else should matter. And then it seems when there are spikes, who's the first person to get blamed? A business owner. Who's the first person to get blamed? A business, period. Maybe these people who go out everywhere and are probably told to wear a mask should wear the damn mask if they're going to dine someplace. Let's not put it on a business owner all the time. Let's not specifically say that bar is an issue. How do we know that bar is the issue and not the people going to the bar who said, my life doesn't matter enough, and the people around me, their health doesn't matter enough because I just want to have a drink. I just want to enjoy reopening. I want to reap the benefits of that. Well, good for you. Look at the case spikes in Florida, Texas, and Arizona's up 19% now. Look at that arrogance, okay? It is not totally the bar's fault. It seems to me people didn't think their health mattered enough. So they just went to the bar, had a drink, had food, got sick. But why? Because they obviously didn't follow the guidelines. We don't want government intrusion, right? But if there are certain guidelines that are seemingly proving to be effective, you follow them. Anywhere, everywhere. Streets of Manhattan, dining, follow the guidelines. Lives matter. Yes, all lives matter. So let's start acting like it. All health conditions matter, so let's start acting like it. Or we're really going to lose our country before we know it. Human economy, people's lives are going to continue to be lost if we don't take our lives seriously, our health seriously, our health concerns seriously. If we just shut off the news when we have a problem and actually call our doc, that's better than saying, oh boy, media's panicking now about COVID. My health condition doesn't matter. I'm just going to, unfortunately, have a sickness here in my home. And maybe they'll get to me, maybe they won't, but I won't even try. That's the message we were sending out to people. It's the wrong message. It's the totally wrong message. Because with the stroke of a pen, policies were in place to literally cancel elective procedures. If I don't look as well right now, it's because I'm not. I shouldn't say that. I'm okay. I could feel stronger. I haven't been able to have food the last days due to this procedure now, due to trying to get back and finish the procedure and do it right. So it's a little tough for me to get up here and say all health conditions matter when I'm feeling frustrated about whatever health thing I'm going through. Because in an ideal world, we're all supposed to be healthy. In an ideal world, we're all supposed to take care of ourselves. In an ideal world, I would say even our leadership is supposed to care for that health care. How can someone say we need a better healthcare system, but we're canceling elective surgeries and there's nothing you can do about it? At the same time, how can we remove 23 million people from Obamacare during this time? We can't. That's inexcusable. That's inexcusable, and I'm not afraid to say that. 23 million people were going to be, if the SCOTUS went another way, we're going to be removed from Obamacare. What? What in the world? I woke up today playing Only in America, Jay and the Americans. It's just like a theme song of mine that has been growing as a theme song. But seriously, in America, we need better healthcare, yes. We do need competition. I don't totally believe in a centralized government-run healthcare system. I don't. But I also don't believe if we're going to have it, to strip it away in the middle of a pandemic. That doesn't make sense. That's saying those 23 million people's health lives